Hello, this is Optimum Health for All. I'm your host, OJ Odia.
Optimum health for all, for all, for all, for all. We're building up strong so we never fall. Mindset, power, we're standing tall. It's optimum health, yeah, it's for all.
Today, we need to talk about common heart disease in children. And we have an expert on heart diseases in children, Professor Petronila Tabansi. Prof, you're welcome.
Thank you, sir. I'm very happy to be here with you.
Thank you very much. We are very happy, very delighted, honored our invitation. Let us start by asking, what are these common diseases and heart diseases in children?
Prof, I was very glad when you invited me to come and talk on this your optimal health today because optimal health also includes optimal health in children. And when people talk about heart disease, sometimes they forget that children have heart diseases. Their heart diseases are different from those we see in adults. So some of the heart diseases that we have in children are what you call congenital heart disease. Many of them. This is what is referred commonly to as hole in the heart. So some children are born with hole in the heart, and there are different types of hole depending on where it is located in the heart. Whether in the upper part, which we call atrial septal defect, or in the lower part, which is ventricular septal defect, or connection between the two big great vessels called patent ductus arteriosus. These are just the most common ones, but there are so many types of congenital holes in the heart. And that kind of common heart disease in children is the one we call rheumatic heart disease, which we see in children usually between the age of 5 and 15. And some people refer to it commonly as leaky valves. In this particular instance, there's some precedence of a particular type of sore throat, which people call strep. Commonly, people see it as strep sore throat, but that organism is a strep pyrogenes. So it can cause a sore throat that, if not handled well and for genetically predisposed individual, may lead to damage to their heart valves, because our valves have valves between the upper and lower chamber, the mitral valve, the tricuspid valve, and then between the lower chamber and the vessels, the aortic and pulmonary valves. So this rheumatic heart disease usually occurs in the mitral or the aortic valves more commonly. And is seen in older children. So they are not born with this one. They acquired it. That's why it's called acquired heart disease. Another group of heart disease in children is infections, mainly viral infections. Some of them may not present acutely, but we have viral myocarditis, which is viral infection of the heart muscles. We have viral pericarditis of the covering of the heart, or even endocarditis or infective endocarditis. So,
Just infection of the heart valves.
Yes, infection of the heart valve. Yes, exactly. Yes, especially in those people that have issues like these holes in the heart. That may be an add-on.
Let's talk about congenital heart disorders, that is hole in the heart and its various combinations. What are the preventive measures that we can take? What causes them, for example? How can we prevent?
Thank you very much, because this is very good area to educate the public. Many a times we may not know the cause why the child came in deformed in the heart like that, which we say is idiopathic, meaning we've talked to the mother, we cannot form. But there are certain things we call risk factors, which may be present in the mother as at the time she was pregnant for that baby. For example, if she's taking drugs, that's why when you're pregnant, they say do not take any drug, because that is when the baby is formed. So many organs are being formed. If you take drugs or chemicals, this include herbal medications, all those alcohol, they may result in a malformation in that baby's heart at that time. So unprescribed drugs and drugs that are not good for pregnancy should not be taken during pregnancy. In our locality, herbal medication, please don't take it. Or alcohol in any amount
Any
is a
form.
risk factor.
So pregnant women should not take alcohol.
No, they should not take alcohol,
Okay.
not even once.
There are certain infections that can affect the pregnant woman that will affect the baby.
Exactly. Some viral infections, like the one we call congenital rubella syndrome, if the mother has rubella, and then this rubella sometimes may not show, the woman may not know, you just have transient rashes at an early stage in pregnancy and may result in not just heart but even eye condition.
So there's a vaccine for it.
Exactly, Prof. That's why this is very important, and I'm very happy to be here because now there's the kickoff for rubella vaccine, and we have not put it truly into our
The immunization
immunization schedule, but pediatricians were always pushing for it. But we can seek it sometimes in combination, mumps, measles, rubella. But they also have rubella vaccines, and we urge every mother or parent that any of your child, especially a female child, they should take this rubella vaccine. It can be sourced in private hospitals. We do have it to prevent this disease in the future.
Okay.
Yes.
Okay. So thank you very much indeed. So we've talked about congenital heart disorder, talked about rheumatic heart disease, which is post-streptococcal throat infection. Those common sore throat, and then part of the problem is that the baby and now or the child,
The child may now, if it's
cannot
exposed,
now develop some form of heart disease due to the streptococcus or
pyrogenous.
throat infection. Okay. So, and there are other same infections, viruses, and so on that can affect the heart. Some infections of the lining of the inner lining of the heart and the heart valves, which is the endocarditis. Thank you very much. So, is there anything that can be done for a baby that has a hole in the heart, for example?
Definitely. The baby can be treated. Most times it's surgery because it's just like having a leak in the tank. You have to close the leak for it to be good. So when they come, most of them will need surgery. First, if you suspect, because you have to suspect, if you have give birth to a child, the child is having difficulty breathing, difficulty sucking, is sweating when it's sucking, you need to see your pediatricians as soon as possible so that they can assess the child and check. Because time is of the essence. The earlier we fix the problem, the more normal the life the child will have as he's growing. Most of them need surgical intervention. Some of them can use CAT intervention. Prof, now we have CAT, may not involve surgery. But after evaluating the child, we will say which one the child needs. So they can go and close the heart. And these surgeries are expensive. I will continue to appeal that they should be included in the National Health Insurance Scheme to make it affordable.
Cost can come down for common man or common woman.
Exactly.
So be able to afford it.
Yes. And the good thing is that they do these surgeries here
in Nigeria. So where it's possible in this country to operate on these children.
Definitely possible.
Have good results.
Very good results.
Very good. So parents out there, you have the children with these conditions, abnormalities, see your doctor, then doctor refer to a pediatrician, for example, and will examine your child, find out what it is, do some tests, and then decide on whether your child requires surgery or not. Now, what of rheumatic fever, rheumatic heart disease?
So for rheumatic fever, rheumatic heart disease, rheumatic fever is one that leads to rheumatic heart disease if that strep pyrogenous sore throat is not treated well. But if the child now has rheumatic heart disease, which is the leaky valve we talked about, there's also surgery for it. First, when we get the child, we put them on an intervention by giving an injection, benzathine penicillin, every month to prevent that valve from getting further damage. Because that infection tends to occur in those individuals, further damaging the valve. Then we may need to repair that valve. So there's also treatment for them.
So there's surgery.
Yes, there's surgery.
It's available in Nigeria.
It's available in Nigeria.
Very good. So these are the basic things.
Yes.
So any general advice you want to give to parents before we close?
Yes, I want to tell all parents there that prevention is better than cure. A lot of people say children don't talk. How will you know they are sick or this and that? Please, once you have a child, as soon as possible, make sure that child is reviewed by the pediatrician. It's not just when a child is sick, you go to the hospital because you don't know, like you said. So you need to go to a doctor. If the doctor examines and feels the pediatrician should see, we will see. So we can prevent some of these things. When you're pregnant or you're thinking of getting pregnant, go to the doctor, the obstetricians. They will optimize your health so that you can have a healthy baby and
healthy mother.
Yes, healthy child. Yes, and healthy nation.
Everybody will be happy
Yes.
and healthy.
Yes.
Thank you very much, Prof. I think we have exhausted this topic.
Yes.
Thank you for coming and being with us today.
Thank you very much, Mark. It's nice to be with you here.
Okay. So, viewers, this is another episode of Optimum Health for All. Thank you for watching us. Please like, share, subscribe. Thank you.
Thank you.
Bye for now.
Optimum health for all, for all, for all, for all. We're building up strong so we never fall. Mindset, power, we're standing tall. It's optimum health, yeah, it's for all. Knowledge is wealth, so we pass it on quick. From the food to the mood, we be flipping the script. From gut to brain, everything aligned. When you live that good life, it's a powerful sign. Balance is the mission, got the vision on deck. Cut the stress, no mess, keep the wellness in check. We thrive, we shine with every routine. Optimum health, you know what I mean. Optimum health for all.